Now let's see how many on this side. 5, 6, 7, 8. How about, you got 9, 10? Have you got it, doctor? 10. All right, a little bit. But you had it more before, is that right?
No, I get about halfway.
Well, then if you get halfway, in other words, if you get a threshold change, which is what the doctor is getting, that's no good. Nobody in this room wants analgesia. You want anesthesia. Analgesia you can break through, and you can break through a lot easier than you can anesthesia. We don't want analgesia. We want anesthesia. Now, what does that indicate? It indicates that the doctor is about 99 and 44/100% sold on the fact that he can do it. But he is not sold 100% on the fact that he can do it. Now, how do you sell yourself 100% when you're not sold 100%? Simply this. When you lock your eyes and say, I can't open my eyes, you know 100% you can't open your eyes. I want you to know you're going to have the anesthesia the same way, and then, doctor, it will come in all the way, and it won't be just a threshold change. You'll feel it complete. Let's try it once more. Let's take the time for it, because I think at this session we should all master autosuggestion so that when we practice it this next couple of weeks, we'll have it well learned by the time the third session comes along. Say that first word, lock your eyes, green. Now, those of you who haven't got it, this time want it. This time believe it. In other words, know that it's going to happen. I'm not saying don't try to make it happen, those are all important, but want it to happen. Stroke the jaw or whatever area you want to anesthetize. Now, imagine it's coming in as you say that word green and watch it come in. Green. Now, feel it coming in. Now, let it come in solid. You want it to come in solid all the way. So say that third word and it will be absolutely solid. Green. Now open your eyes and you'll have it. Now we ought to have a lot of them with it. Let's find out how many we have on this side. How many have we got? 1, 2, 3, 4. What's the matter with it? What's the matter with you?
I don't know.
Well, you got it before. You're probably resisting it, is that it? Well, then try it on the hand or something, or some other area. And you'll be able to put it back on the jaw. 4 on this side yet. Let's see if any more, if you got it, Dr. Woods. How many? 5, 6, 7. Did they come in more solid that time, Doctor? 8. How about you back here? 10. We didn't make any improvement that time. Well, we're going to stop on that and go on to other things. Friends, this time I would like you to spend 300 seconds a day practicing this until you get it. You'll thank me so much if you really learn autosuggestion and become adept at it. Let some of the old students tell you how some of the men have used it over the months since I taught here last year. And then you'll begin to see what a wonderful thing autosuggestion is. In other words, don't sell autosuggestion short. Give yourself about 300 seconds a day. 300 seconds a day is 5 minutes. And autosuggestion, 5 minutes a day for 2 weeks, and there isn't a person in this room that won't have autosuggestion mastered. And you will be very proud of the fact when you have autosuggestion mastered. Now, let's go on to this technique for tonight. The method that we are going to show you tonight is the best method ever conceived for hypnotizing children. The fastest and most rapid method in the world. And it will do such wondrous things for the children that you work with. We never consider the handshake technique as good for youngsters. And we don't particularly aim to tell you that at the first session. And so oftentimes we get reports from doctors that they've been successful with 5-year-olds and 6-year-olds and 7-year-olds using this technique. But as a matter of fact, it's when we get to this technique that I want you to start working with the youngsters. Since this technique is the fastest method ever devised for obtaining hypnosis, many people have the notion that it is a Dave Ellman invention. It is not. This was a development of the Bernheim and Leopold technique, used as much as 60 years ago. They used it in its 10-minute format. Once I learned what hypnosis was all about and what constitutes hypnosis, all I did was to show that the same method would have been equally efficient if they had done it instantaneously instead of waited 10 or 15 minutes for the results to occur. And you'll see that the results are instantaneous. Now, just because the results are instantaneous, don't think to yourself that this is some light form of hypnosis. Because I can give you reports of hundreds of doctors, both in medicine and dentistry, who have done extended work using the technique that you're going to see us use now and that you're going to practice tonight. This technique is wonderful for children, equally wonderful for adults. But the strange part of it is, the reason we don't stop right there and say that's as far as we go in the teaching of techniques, because if this is the fastest method ever devised for children and it's equally good for adults, where can you go from there? The fact of the matter is that for adults, a better technique has been devised. But no better technique has ever been devised for children. Now, I'm going to show you the technique as applied to youngsters first. Would one of you ladies mind being my little youngster for a little bit? Would you come up? Come on up. All right, just sit there. Now here, we're going to pretend now that you're about 4 years old, 5 years old, and you're in the dentist's office, and the dentist is talking to you, and he's saying something. What is your first name?
Jean.
Jean. Jean, I guess you play a lot with your dolly when you're home. You've got several dolls, I suppose, and I suppose when you were 4 years old you did have a doll or two, is that right? And you probably pretend a lot with them, is that right? Well, you know, we have a little game of pretend, too. And if you can learn to play this little game of pretend, nothing that happens in the dentist's office will bother or disturb you at all. You just won't feel anything that we're doing if you learn to play this little game. Would you like to learn it? All right. Open your eyes wide. I'm going to show you this little game. I'm going to pull your eyes shut like this. Now, you pretend with your whole heart and soul that you can't open your eyes. That's all you have to do. Just pretend that. Pretend it's so hard that when you try to open them, they just won't work. Now try to make them work now when you're pretending like that. Try hard. It just won't work, see? Now, just because you're pretending like that, anything we do in this office won't bother or disturb you at all. Why, in your mind, you can be home playing with your dolls now, and you just won't feel anything that we have to do. And now, doctor, you're in dentistry. Would you come up here, please? And go inside her mouth, and you'll find that she doesn't have a feeling in the world. Now, I want you to see the absolute anesthesia that you get with this technique. Watch this. Well, you can make a good test, doctor. Don't be afraid to make a good substantial test. She won't feel it anyhow. You make a good test?
I think it's pretty good.
Come on up here, doctor. I want you to see this because you've got to see that. You've got to see that this works. Make any test you want. You'll find she's got better anesthesia than any anesthesia you were ever able to give in the dental office. Make any test you want.
If you give her a milk, you make it hurt much more and give her a milk.
You could actually extract teeth, and the patient would not feel it at this point. Just because you have just got such a perfect state already. Keep your eyes closed, please. Keep pretending you can't. You're playing with your dolls and you can't open your eyes. And now, when I have you close your mouth is going to feel better, and it's felt all day. Now you can close it. When I have you open your eyes, your mouth is going to feel better, and you felt all day and all week, and you're going to feel so good. Now open your eyes and notice how good you feel. How do you feel? Huh?
Fine.
What'd you feel while they were working with you?
Nothing.
Nothing. Did you hear that, doctor? Nothing. Because I want you to see how fast this is. Thank you so much.
But let me ask you something. Why do I remember what you said?
Because you're not supposed to be unconscious in hypnosis. You aren't unconscious. This is not sleep, you know. I must have contact with you. Do you see what I mean? Otherwise, you couldn't obey orders. So you've got to hear. Now, I've never seen the lady before, so far as I know, and I don't think she's ever seen me. Is that right? All right. And yet you see how instantaneous the hypnosis is. Now, this is not unusual. This is not an unusual case. You use that technique. Doctor, you work with many kids. How does this technique work for you? Excellent. Here you have a technique that is so wonderful. I'll never forget. I think I told you about this last year when I was teaching this same semester, and I told about the man who comes to the class, the third session. He's the first man to show up. And he says, that technique you show for the children doesn't work. And I said, doesn't work? I said, wait a minute, did you try that, doctor? And he says, no. I said, well, how in the world then do you know that it doesn't work? So common sense tells me a thing like that won't work. I said, all right, doctor, wait till the others get here. I can't tell you any more than that until the others get here. That happened to be a full class of 20 men, and when the 20 men got there that night, I said, how many of you used the two-finger eye closure technique for children this past 2 weeks? 18 hands went up. One man happened to only work with adults in that particular class. And the 20th man was the man I speak about. 18 hands went up. How many of you were successful with it? 18 hands went back up. I said, now, doctor, look around and count those hands. The only hand that isn't up is yours, who didn't try it, and the man who only works with adult patients and doesn't work with children. You have a technique here which is fabulous for children, and it is equally good for adults. Now, how about you? Would you like to come on up? I want to show you the same technique now used on an adult. And I want to show you that the same thing holds true. With a child, you approach the child on the child's level. You'll notice that I approach the child on the game technique. You want to play a little game. You play games at home. Well, I want to play a little game in this office, and if you learn to play this game, nothing that we do in this office will bother or disturb you. So the child wants to play the game, so you play the game, and if the child plays the game properly, the child doesn't feel anything. But now we approach the adult on the adult level. After all, I've got to be a little bit more indirect with the adult because, well, the child bypasses his critical factor completely, but the adult takes a little bit more encouragement to bypass the critical factor. So I might say to this patient, I might say, you know, every time you come to this office, I notice how tense you get. And if I could teach you how to relax, you wouldn't mind anything we have to do. So suppose I teach you how to relax. Would you like that? All right, take a good, long, deep breath. Watch how similar this is to last week's technique and get what beautiful results you get instantaneously. Now open your eyes wide. Now I'm going to pull the eyelids shut like that. Now I want you to relax the muscles that were underneath my fingers. Relax them to the point where they just won't work. And when you're sure those eye muscles won't work, test them and make sure they won't work. Test them hard. That's right. Now let that feeling go right down to your toes. Let it go all the way down to your toes. And when I lift your hand and drop it, that hand will be so relaxed it'll just plop down into your lap. And just let it plop. That's it. I've got a beautiful state here. She wouldn't feel any more than the other lady that was up here just a moment ago, because she gets the state instantaneously. Now, in order not to have her feel, it is necessary that you do give suggestion. This is where you put in your selective thinking. You don't want her to feel. You know that she is quite capable of having as good an anesthesia as the other lady. Now, how do you give her the anesthesia? Here's how you give it. Anything that I do from this point on, or anything that we do in the way of working on your mouth or any other part of your body that we might work with, you just won't feel anything from this point on. Just stay relaxed like that. Make sure at all times that your muscles won't work, the eye muscles won't work, and that relaxation is all through your body, and you just won't feel a thing. Now, gentlemen, I'm going to show you the degree of anesthesia which she has already as a result of that suggestion. I'm going to stroke your hand right here, and I'm going to work with it, your arm, and you just won't feel anything. You'll know I'm working there, but nothing will bother, nothing will disturb, and she'll have the same anesthesia the other lady had. Watch. Now, that was an Alice clamp to the second notch. Now, when I have you open your eyes and notice how good you feel, I just want you to tell me just how good you feel. Open your eyes, please. How do you feel?
Fine.
What'd you feel?
Oh, I forgot to do something. Felt you do it.
Yeah, but
Didn't feel any pain.
didn't feel any pain. All right. The awareness stays, but the pain does not stay. Now, we happen to have someone in our class who has been using, apparently without her knowledge, who has been using autosuggestion beautifully on herself. She did something tonight that I can't do to myself, and as adept as autosuggestion as I am, I'm unable to do what she's able to do, and she showed it to me before class. These are pretty tight Alice clamps. She can put these, I think, any place on her body, and she doesn't mind them at all. And it isn't tolerance, because if it was tolerance, it would be masochism. But it isn't masochism, because she doesn't feel it. Is that correct, Doc? Huh? There's autosuggestion developed to a high level already. She probably gives herself as good an anesthesia as you had. You could feel that something was there, but didn't feel anything bother. Is that right? Mm-hmm. Now, gentlemen, we're going right back to this thing now because I want you to see the technique again. Watch the technique because we're going to start practicing this in a couple of seconds. And I want you to see it. Now, I'm going to show it to you from the child level again. I'm going to show it from the adult level again. Then I'm going to show it on a doctor with the child level, the adult level. And then I want you to practice it both ways. In other words, I want you to practice it as you would approach a child, practice it as you would approach an adult. Now here, we are approaching an adult at the present time. So I approach by saying something like this. Now, I notice how tense you are whenever you come to the office, and every time we have to give you any medication at all, why, I notice that you just get all tight all over. So suppose I show you how to get loose all over, relax all over, so that you don't feel anything. Would you like that? All right. Take a good long deep breath. Now let it all out. Get rid of that surface tension. We get rid of all those tensions. Now open your eyes wide. I'm going to pull your eyes shut like that. Now relax those muscles that were underneath my fingers to the point where those eye muscles won't work. Now when you're sure they won't work, test them. Then let that feeling go right down to the toes. Now when I lift your hand and drop it, that hand will be so relaxed it'll just plop down on your lap. Now we've got the state. Anything from here on in is the hypnosis because all that was pre-hypnotic. But notice in about 15 to 20 seconds the entire approach and the actual hypnosis is obtained. Now we have the hypnosis because any selective thinking that I wish to establish at this point, which is not out of the norm for the patient. That is, if I had work to do on this patient, and she didn't want to feel anything, she could accept a suggestion for anesthesia. She could accept a suggestion for any kind of work. For instance, suppose I had to take her to the next room for an examination, we'll say an internal examination. Your suggestion would be given in this fashion. Now, in a moment or two, when I have you open your eyes and the nurse takes you into the next room and gets you ready to get on the table and so on, why, when you're on that table and all ready for the work, I want you to close your eyes like you've got them now. And just relax those eye muscles to the point where they just won't work again. And then you just won't feel any work that we have to do. And any examining that we have to do, you'll find you just won't feel a thing. And then, gentlemen, you could make a test, and you would find that she has complete anesthesia, and that any examination that you have to make in GYN work, OB work, or anything like that, you would find that that patient is so relaxed that you get a perfect reading at the first examination without difficulty, without the patient being all tense and fighting you and not letting you get the information that you need clinically. You'll get the information from the patient in this state, and you'll get it very easily. We're all through working with the patient now, and when we bring her out of the state, I want you to notice how good she feels. Now open your eyes and notice how good you feel. How do you feel? Isn't that nice? And notice the signs, gentlemen. Can you see the signs from where you are? The ingestion of the whites of the eyes is evident probably from where you're sitting. Is it evident to all of you? Also, the increased lacrimation. You've seen the approach now for the adult twice. Now watch the approach for the child again. Now she's a little 4 or 5 year old girl, and I might say something like this to her. You know, what's your first name?
Loyette.
Loyette. Loyette, you know, we have to do some work today, and let's make it fun instead of work, should we? We can do that very easily. You play games at home, don't you? Well, we can play games right here, and if you play the game that I teach you, any work that we have to do you won't even feel while we're doing. Would you like to do that? All right. Now, here's what I want you to do. I want you to play a little game of pretend. Will you open your eyes wide, please? That's right. Now I'm going to pull them down like this. Now you pretend you can't open your eyes. That's all you have to do is pretend you can't open your eyes. And now while you're pretending, try to open them. You see, you can't. And now just because you're pretending so good, nothing that we do in this office will bother or disturb you because you're playing the game just right now, and nothing will bother you. And gentlemen, that's all that you need for an astounding amount of anesthesia. You'll get a wonderful analgesia, and in most cases, you will have a complete anesthesia at this point. I want to show you the adaptation of this approach that was used in East Chicago at St. Catherine's Hospital to set a compound fracture on about a 12-year-old boy. The kid had a terrible accident, and that arm, they say, that bone was just shattered. I want to show you the technique he used. Would you open your eyes, please? Now you feel wonderful. Now, here was his approach to this little boy. You must know that he had intended to set this with the aid of anesthesia. The anesthetist, however, was working on another emergency case upstairs. And since this doctor prefers this anesthetist beyond all others in that hospital, he was waiting for him. In fact, he told me no other was available, even if he wanted, because it was in the middle of the night sometimes. It was late at night. The only person in the hospital that could have helped him was the man upstairs who was working on the other emergency. And finally, he couldn't stand the suffering of this kid anymore, and he said, look, I've got to help you instantly. I'll tell you what you do. Open your eyes wide. Now close them like this. Now you pretend that you can't open them. That's all you have to do. Pretend hard, and then try to open them while you're pretending. And now just because you're pretending so hard, anything I do from now on, you won't feel at all. Nothing will bother, nothing will disturb you, but you just keep on pretending. That's all you have to do. And he proceeded with that little bit to set a compound fracture, a bone that was shattered. Now, when I have you open your eyes, you're just going to feel wonderful. How do you feel? Thank you so much. All right, that's what I want to show you. So if you want to make it short, gentlemen, that last approach for the emergency victim is an awfully fast approach, and you get hypnosis within 5 seconds, and I don't think anybody can ask for it any faster. It's such a fast approach, and you get hypnosis so instantaneously, and you get the bypass of the critical factor, and you get your anesthesia so fast that it's astounding. Thank you so much. I won't hold you any more with this.
Do you always test for muscle relaxation, or do you decide?
Only with the adult, not with the child. With the child bypasses his critical factor so completely and so instantaneously, doctor, that usually when you use this technique with a child, once you say, pretend you can't open your eyes, and he pretends, and then all of a sudden he slumps, and it's just as though he goes into a sound sleep, but he doesn't really sleep. Have you noticed that, Dr. Tenderow?
We haven't had a child cry from induction of anesthesia since I took the course.
Yeah.
It's a beautiful thing, roses, flowers, and
Yeah. You see, that's just how they use this technique in the induction of actual anesthesia for surgical purposes, and you can use it for that beautifully. Now, let me show you the technique on one of the doctors, and then we'll start practicing. Suppose you come on up, doctor, would you please? I want to remind everybody that there is plenty of material besides what we're going to do right now in tonight's session. We consider our second session one of the most important of all our sessions because it is now that you're beginning to work with deep hypnosis and you don't realize it. So therefore, even after we finish what we're doing now, there's still a lot for you to know. So keep your tapes on. You'll want all the information that we get besides the practice and everything else. Doctor, would you remove your glasses, please? Here is the approach to the child. I'm doing it to you so that you will remember and how to do it to the next doctor that you work on. What's your first name?
Ben.
Ben, you play games when you're home. You're 5 years old, we'll say. You play games when you're home. You probably play cops and robbers and pirates and space cadets and everything like that. Is that right? How'd you like to play a little game in this office? Because if you play a little game with me, anything we do, you won't feel. Would you like that? All right, I'll show you this little game. Open your eyes wide. Now, I'm going to pull them shut, and all you have to do, Ben, is pretend you can't open your eyes. Pretend it's so hard that when you try to open them, they won't open at all. Now, try hard to open them, and you'll see if you're really pretending they won't open. Now, Ben, just because you're playing this game so good, nothing that we do in this office will bother disturb you from now on. And now you give them the selective thinking, and you go right ahead. You don't test with a hand. You don't do anything. With a child, you can go right ahead. And now, if you want a deep state, you can now have them smell beautiful roses for the anesthesia if you're preparing them for surgery. Or you can now say, now, what's your favorite game when you're home? Or what do you like to watch on television? And you can actually have the child watch a television show while you're doing painful medical or dental work on the patient. For example, you might say, suppose his favorite game is football. Well, you could have him be playing a game of football while you're doing your work. Another thing that is frequently done is to have the kid go on a trip to the moon in a spaceship. Now you're on a trip to the moon. And just be on that trip to the moon now, and while you're on that trip to the moon, I'll do the work on you down here, and you won't even feel it. And at this point, you can go ahead, you can give him injections, you can give him various types of treatment, and so on, and he just won't feel it at the present time. I don't know where his threshold is, but I'll venture to say it's far removed from a normal threshold. You're all through working with him now, you want to bring the kid back to Earth. You say, all right, you can come back from that space trip now and come back to Earth now, and when you open your eyes, I want you to notice how good you feel. Open your eyes. How do you feel? And notice the redness of the eyes. Notice the increased lacrimation. And did you notice the eyes flutter? Could you see them from where you were? Because if you couldn't, watch it again as we get the... Yes, doctor?
Now, if you do this when he first comes in, then you want to take his shirt off and listen to his chest and listen to his ears and all that. He obviously has to open his eyes, and you may have him sit up on another table. Sure. How do you do
well,
that?
Here, I'll do that now.
You have to roll up the sleeve, and he knows
sure
you're going to give him a shot.
Sure. Therefore, you would do it this way. You might want it to prepare him first. You might want to do that. After you've done this once to him, we'll then let you roll up his shirt or whatever it is, or bare his buttocks so that you can give him a shot or whatever it is. But right at the present time, you might want to relieve his apprehension before that happens. So you would do it this way. I'm going to make the adult approach now, but the same thing would be true.
What I'm getting at, you try and keep the eyes closed.
Oh, no, doctor, no. Suppose, here, I'll do it again. His eyes are shut. Now pretend you can't open them. And now, Ben, nothing that we do in this office from now on will bother, disturb you at all. Now, in a couple of seconds, I'm going to have you open your eyes and get your arm ready so that I can work with it. And then we'll play this game again, and you'll see you won't feel anything that I have to do. Now, you open your eyes and get your arm ready. And you'll find that the suggestion will help him get his arm ready or his hip ready or whatever area you're going to work with. You've got to work with his abdomen or the rectal area or any area. You can take him
back down before you actually plunge.
Oh, yes. Yes, you do, doctor. Then you say, now we're going to play that game, and I'm going to prove to you you won't feel anything. Now, pretend you can't open your eyes and stay that way. I'll do that work, and you won't even feel what I'm doing at all. And, doctor, at this point, I could give him a painless injection with a number 20, and he wouldn't feel it. That's how fast it is and how easily it works. It works with anybody, providing you bypass the critical factor and implant the selective thinking. That's the whole crux of hypnosis. Now, you're all through working with him, so now you have him open his eyes and notice how good you feel. How do you feel? You say that to a child just the same as with an adult. Be sure you get his answer, good. And then, now we're going to take the approach for the adult. We'll say now that he's got to come in for some difficult proctological examination, we'll say, and you know that area is probably the most difficult on the human body to anesthetize.